Welcome to Roadmap Residency Evidence-Based Applications. Hello everyone, I am Abhiraz. Welcome to our Club 250 Matchmaker sessions. We will be running through some questions with you guys to help you on your journey to a 250. So here we have, which anatomical structure is most likely involved in the region where the lump is palpated? A 32-year-old woman notices a painless lump in her left breast during self-examination. She seeks medical attention and the physician performs a breast examination. The lump is found in the upper outer quadrant of the left breast, and the physician notes it's fixed with irregular borders. There are no associated skin changes or nipple discharge. Which anatomical structure is most likely involved in the region where the lump is palpated? Mammary gland, Cooper's ligament, lactiferous duct, suspensory ligaments of axilla or areola. So Cooper's ligament, also known as suspensory ligament of the breast, are fibrous connective tissue bands that provide structural support to the breast tissue. They extend from the deep fascia overlying the pectoralis major muscle to the skin. When the lump is detected in the upper outer quadrant of the breast with fixed irregular borders, it may suggest involvement of Cooper's ligament. Changes in this ligament can contribute to the development of breast lumps and may be associated with conditions such as fibrocystic changes or breast cancer. Now, this is about the breast anatomy. So it lies in the superficial fascia or pectoral region and extends vertically from second to sixth ribs, horizontally at the lateral border of the sternum to the medullary line. It lies on the deep fascia, that is also called as the pectoral fascia, and separated from the fascia by the retromammillary space. So here you can see this is the second rib, this is the sixth rib, so it extends from second rib to the sixth rib. This is the pectoralis fascia, lies above the pectoralis fascia. This is the pectoralis major muscle. This is the pectoralis minor muscle, and now this is the retromammillary space. So pectoralis fascia, and this is the breast, and between the pectoralis fascia and the breast, this is the retromammillary space, which separates the pectoralis fascia and the breast proper. Now, talking about the nipple, which is a conical projection, presents just below the center of the breast at the level of the fourth intercostal space, 10 centimeters from the midline. The nipple is pierced by 15 to 20 lactiferous ducts, and it contains circular and longitudinally smooth muscle fibers, which can make the nipple stiff or flattened, respectively. It has a few modified sweat and sebaceous glands. Here we can see the fat tissue, the breast alveoli, and then the alveoli connected by the lactiferous ducts, and then there are the lactiferous sinuses, and then there is the nipple through which there is the flow of the milk. So stroma forms the supporting framework of the gland, and it is partly fibrous and partly fatty. There are fibrous bands that provide structural support and insert perpendicularly into the dermis, termed the suspensory ligament of Cooper. That is why if involvement of Cooper's ligament, it will cause skin traction. Talking about the lymphatic drainage of the breast, which is very, very important. So whenever there is a metastatic breast cancer, the lymph node will be involved. And the typical group of lymph nodes that is involved is the axillary group of lymph nodes. So breast lymph, and then it drains into the anterior and posterior group, central and lateral group, and apical group, and ultimately it all drains into the supraclavicular group of lymph node. But what they typically ask you in the examination is about the axillary group of lymph node. And the simple question that they will ask you in the examination is, whenever there is breast cancer, there will be lymph node drainage or lymph node involvement of the anterior axillary group of lymph nodes. So which hormone is primarily responsible for the milk ejection reflex during breastfeeding? Prolactin, oxytocin, estrogen, progesterone, or human chorionic gonadotropin? Very simple and easy question. So oxytocin is primarily responsible for the milk ejection reflex, also known as the let-down reflex during breastfeeding. When a baby suckles at the breast, sensory nerve stimulation triggers the release of oxytocin from the posterior pituitary gland. Oxytocin acts on the myepithelial cells surrounding the alveoli and ducts of the mammary glands, causing them to contract. This contraction results in the expulsion of milk from the alveoli into the ducts, making it available for the baby to consume. You also need to know that not every time there should be a nipple stimulation by the suckling of the baby. Sometimes the crying of the baby, the crying sound of the baby, or sometimes even the thought of the baby can trigger the milk letdown or milk ejection reflex. So talking about the physiology of lactation. So lactation can be divided into 5 stages: mammogenesis, lactogenesis, galactokinesis, galactopoiesis, and involution. So mammogenesis is the development of breast to functional state. Lactogenesis is when there is synthesis and secretion of milk from the breast alveoli. Galactokinesis is the ejection of milk outside the breast. Galactopoiesis is the maintenance of lactation, and involution is the regression and atrophy post lactation period. So there are some hormonal influences during the mammogenesis. So the prepubertal growth depends on the estrogen and progesterone. The secretion of prolactin and somatotropin by the pituitary gland results in mammary growth. The adrenocorticotropic hormone and the thyroid stimulating hormone acting on the adrenal gland and the thyroid gland also play a major role in the growth of the mammary gland. Hormonal influence during mammogenesis, pubertal growth. So when the hypophyseal ovarian uterine cycle is established, there is extensive branching of the duct system and parenchymal proliferation and canalization of the lobulo-alveolar units controlled by estrogen and progesterone. Now, during the gestation period, so this is the hormonal preparation of breast during pregnancy for lactation. So the placenta corpus luteum, it produces estrogen, okay? Also, it produces the human placenta lactogen, and then it acts on the hypothalamus, which inhibits the secretion of HGH and FSH, LH releasing hormones, and depletion of the prolactin inhibiting factor. Now, whenever there is decrease in the prolactin inhibiting factor, the adenohypophysis, which is generally inhibited by the PIF. So because the action of PIF is not there, then the adenohypophysis gets stimulated and it releases prolactin. And then the prolactin acts on the breast, and this is how the different changes in the breast is occurring there. So during suckling, a conditioned reflex is set up. The sending impulses from the nipple and areola through the thoracic sensory nerve goes up into the paraventricular and supraoptic nuclei of the hypothalamus. The oxytocin from the posterior pituitary produces contraction of the myepithelial cells of the alveoli and the ducts containing the milk. And then the milk is forced down into the ampulla of the lactiferous ducts, where form it can be expressed by the mother or sucked by the baby. And this occurs between 30-second to 60-second of time period. So there are some of the other factors affecting lactation. There are some maternal problems like stress, polycystic ovarian syndrome, theca lutein cyst, obesity, liver analgesia, diabetes mellitus type 1, placental retention, which causes the increased circulating progesterone, and alcohol dependence. Some medications that increase the lactation include metoclopramide. Now this slide is very, very important. Very frequently after the examination, metoclopramide, domperidone, phenothiazine neuroleptics like chlorpromazine, risperidone, hypoglycemics, S2 antagonists like cimetidine, and antihypertensive like methyl-dopa and beta blockers that reduce the lactation. The bromocriptine, progesterone, estrogen, clomiphene citrate, ergotamine, pseudoephedrine, pyridoxine, prostaglandins, or levodopa carbidopa. There are some benefits of breastfeeding. So breastfeeding, the infant health benefits include the colostrum, the initial production of colostrum. So it is a small amount for the immature digestive system, and it paints the digestive tract. It has low fat for easy digestion, contains the mother's antibodies which boost infant's immune system, and it acts as a laxative to ease the passage of meconium. The milk comes in the transitional milk for up to 2 weeks, may still have yellow appearance. The amounts increase quickly as infant hungers and digestive system matures. Mother's milk making changes from endocrine to autocrine system. Mature milk, that is, which supplies the demand system, engorgement decreases. The properties of fore milk and hind milk is present in the mature milk. So there is a lower risk of diarrhea, constipation, infections, SIDS, allergic diseases, chronic digestive diseases, juvenile onset diabetes, acute leukemia, or adult obesity in patients who are being breastfed. Preterm infants, decreased necrotizing enterocolitis, decreased ROP, decreased infection rates, better able to tolerate feedings, and they have the increased IQ rates. Whereas there are some other health benefits towards the mother too, and they include the less postpartum bleeding, more rapid uterine involution, weight loss, decreased premenopausal breast cancer rates, decreased ovarian cancer risk, and lactational amenorrhea, which can provide as a method of contraception. There are some complications. So infants at risk of poor weight gain. So example, if the infant is a premature infant, if the infant has a difficulty in the latching on, if the patient has ineffective sucking, if there are twins or multiples, if there is jaundice in the infant, if there is cystic fibrosis or infection, then these sort of infants have a risk of poor weight gain if they are being exclusively breastfed and are not fed with other supplements. So which medication is commonly used to suppress lactation by inhibiting the release of prolactin? Oxytocin, metoclopramide, bromocriptine, leuprolide, or nifedipine? So bromocriptine is a dopamine agonist that is commonly used to suppress the lactation by inhibiting the release of prolactin. Prolactin is the hormone responsible for milk production, and by reducing its release, bromocriptine helps decrease the lactation. However, it's important to note that bromocriptine is associated with potential side effects, and its use is carefully considered, especially given the safety concerns. Alternative medications such as cabergoline are sometimes preferred due to the more favorable side effect profile. Thank you for watching. Keep studying hard.